Regenerative medicine is really a technique, a science that really tries to harness the power that we all have as humans to regenerate ourselves. So we're constantly regenerating. We are turning over skin every 2 weeks. So regenerative medicine really says, okay, we know the organ can regenerate. How can we maximize that when there's injury, when there's disease, when organs fail? Regenerative medicine really has its roots all the way back to the 1930s. In fact, there's a textbook that was published back in 1938 titled The Culture of Organs. And so this concept of having these organs when others fail and actually creating structures that you can keep alive and implant has been around for a long time. As a pediatric surgeon, I take care of bladder disorders, and so we were dealing with babies who needed to have their bladders replaced or repaired. We started on this work and we really had absolutely no idea how complex it would really be. The fact is that we really didn't even have a method where we could actually get these cells to grow outside the body. So we had many challenges along the way, trying to get the cells to grow, trying to create three-dimensional materials that would hold the cells together, and really trying to grow the organ from the ground up. So by using the patient's own cells, we're able to grow these cells outside the body, create this new tissue or organ, and put it back into the very same patient. So there are no issues with rejection. Probably the one thing which was the biggest hurdle that we had to overcome was to be able to grow all these cell types outside the body to make sure they were normal and to make sure they would function. Well, you know, it took us a long time to actually get to the point where we could finally say, okay, we are now ready to put this into patients. And of course, that's always a very, very, you know, nervous experience, I must say, because you're, you know, as much as you do the work in the laboratory and you do this experimental work beforehand, you never really know what's going to happen until you finally put it into the patient. We initially reported on 7 young patients, and we actually had several protocols that we used. So we changed the protocols along the way. So we learned from our experience. We kept making it better and better. And thankfully, you know, we were able to achieve good results, and I had the pleasure of meeting up again with some of these patients years later, and we still stay in touch with them.